Hello, today we are going to discuss the importance of chaplaincy and the spiritual care in the hospital setting or GP setting or healthcare in general. So we know that healthcare is not only about treating the disease. Healthcare is also about caring for the human experience and the human experience of illness in particular. The patients facing serious medical conditions often struggle with emotional distress, fear, existence of the questions in life about their suffering, particularly happens in those suffering from cancer and end of life care. For many individuals, spirituality provides an important source of strength and comfort during these moments. In this context, chaplaincy services play a crucial role within the hospitals and all healthcare institutions. Now, within NHS, chaplaincy teams support the patients, all the faith and all the belief. However, the awareness and availability of the Hindu chaplaincy services remain very limited, and this is across the country. There are some hospitals where is huge amount of the Hindu population, it is probably slightly better. As the Hindu population in the UK is continuing to grow, it becomes increasingly important that we ensure that Hindu patients receive access to spiritual support that reflect their traditions and values. Hindu chaplaincy is rooted in the philosophical principles of the compassion service called seva and the spiritual well-being. A Hindu chaplain provides emotional and spiritual guidance to the patients and families during the times of illness, time of recovery, time of bereavement. And that is so crucial. And that is so important in form of prayers, sacred readings from the text, Bhagavad Gita, particularly that provide the listening in presence of many situations. And that is very reassuring and giving the hope for people to live for whatever time they have left in their life. The presence of Hindu chaplain can particularly be meaningful during the critical moments, such as end-of-life care. And many Hindu families wish to perform the prayers or rituals that are important for the peace of their patient. These practices may include chanting sacred mantras, placing sacred water or tulsi leaves near the patient, or reciting passages that offer spiritual comfort. When hospitals provide supportive spaces for such practices, families feel respected and supported during the deeply emotional experiences. In addition to supporting the patients, Hindu chaplains can also help healthcare professionals understand cultural sensitivities. For example, they may advise on religious consideration related to the diet, fasting, spiritual observations, etc. And by working collaboratively with the clinical teams, chaplains contribute to the holistic patient care that addresses the emotional and spiritual needs alongside the medical treatment. Another valuable contribution to chaplaincy services is community engagement. Chaplains often act as bridge between the hospital and faith communities, helping to build the trust and understanding. They can encourage volunteers, provide educational sessions, and these are so important for all the well-being of the patient, whichever situation they are in. Cultural awareness and staff support for the well-being and offering the moments of reflection and resilience is so important. We believe that the Hindu National Health Network is committed to advocating for improved access to the Hindu chaplaincy services across the NHS hospitals by raising the awareness and encouraging the partnership with the Hindu organizations. The network hopes to ensure that every Hindu patient has access to the spiritual care when needed. Healthcare that recognize the spiritual dimensions of healing is more compassionate and holistic is so useful in every patient's life. And by strengthening the chaplaincy services, the NHS can contribute and honor its commitment to caring for the whole person, the body, the mind, and the spirit. Thanks.